So hey everybody, I just wanted to talk today about a phrase that is thrown around so often. It's almost become meaningless because it's been thrown around so much, and that is post-traumatic stress disorder. And it's really very simple. Post-trauma, after trauma, right? The thing that we're describing is not what happens during the trauma or up to the trauma, it's after. It's the stress response after a trauma. And that could be a traumatic family experience of violence, physical abuse, sexual abuse. Could be in a neighborhood where we saw somebody get shot. Could be a school shooting. It could be refugees who are victims of war. And it's increasingly the case in a very chaotic world, and a world where we are in Cold War II, where more and more people are experiencing these types of symptoms, and these types of symptoms are oftentimes, seen as something as simple as, persistent agitation, very difficult to control emotions, impossibility in concentration, isolation, depression, poor use of time management. Inability to keep jobs. And, I think a lot of this comes from, in my own experience, because I certainly was diagnosed with that, coming from a number of things. One was a very violent, chaotic upbringing in a home where probably both my parents had PTSD, where there was a lot of violence and yelling and screaming and fighting and throwing things, and where there was very seldom peace. Secondly, as a gay man coming out in the late 80s, so many people were dying of AIDS. And in my generation, 30% of my generation died from AIDS, right? And 20% died from drug and alcohol related overdoses from PTSD. And so one half of my gay cohort is gone. And so thirdly, I've lived all over the world, in quite violent parts of the world. Over the last 25, 30 years. Much of my life has been spent overseas, in Asia, Jakarta, Hong Kong, Tokyo, all over. And I have been working in drug addiction treatment for 21 years, and God knows I've seen my share of deaths and overdoses and murders. And so for me, very clearly it's apparent. But I do think that even for people who have somewhat regular lives, I think that what we see all over the internet, what we see on social media, is more and more unfiltered news that is violent and gory and bloody, and previously would never have been shown on television because it was too graphic. And so I think that, if anything, these numbers are going up, and these numbers, when they go up as a post-trauma stress response to violence, near violence, threatened behavior, sexual violence, sexual assault, I think this is all part and parcel of our modern world, unfortunately. And I think also with the persistence of and the increased use of more and more synthetic drugs like GHB and ketamine, I think we're getting increased instances of sexual assault. And so more and more people, men and women, straight men, gay men, women, who I'm seeing are victims of sexual assault because they've been involved with using ketamine or GHB, which are central nervous system depressants, which can cause a sort of out-of-body experience, which can result in feeling checked out or knocked out, or they often refer to these as date rape drugs. And this is particularly acute in the gay community as well, where men will take these drugs and they'll combine them with other drugs like crystal methamphetamine, or lots of alcohol, or cocaine. And what will happen is they will end up being in a situation where they will have multiple sex partners, and the next day they wake up and they realize that things have happened. And so this is where we have situations where people have to people are experiencing PTSD because they've been a victim of a sexual assault, which they do not even remember. And so this is something else which is also problematic. And so why do we discuss this now? EMDR is something I've come across in the last 5 to 6 years. I've been doing a lot of it. It's been really something that has become very important to me, and it's important because I see it as something that is important. Because why? Because it works. It has shown to be highly effective. It is very much not talk therapy. It is something that it works to get to the heart of PTSD symptoms very quickly in a safe and effective and gentle manner in a controlled circumstances where the person is, completely and fully conscious and completely and totally in control. And so this is something that's really important when we're dealing with these types of situations. And so the example I would give you is drawing forth a specific instance by using eye movement, by asking a person to follow your fingers back and forth, doing eye movement for about a minute or a minute and a half over several times. And this can then result in the left side and right side of the brain, basically starting to talk to each other, where the emotional part of the brain is talking to the rational time and space part of the brain. And we begin to draw together events with time and space and color and who was there. I was there. Who was there with me? And so we can see these events as they come forward in a controlled, calm environment, and names, places, events can come forward. And as they come forward, people can recognize this happened to me. And then we can attach emotions to what happened with this happened to me. And with the eye movement, you have a capability of bringing these oftentimes hidden unconscious memories to the forefront and allowing these memories to take shape and to become clear and cogent and apparent and crystal clear. And that takes away a lot of the fear, because a lot of the times when we're trying to bring forth memories into the frontal part of our mind, just in talk therapy, it comes in a frightening jumble. And EMDR is very different. EMDR connects the emotional part of the brain with the part of the brain that is time and space and events and specifics. And that's really, really important. And when you do these things together, then we can begin to say, aha. We have these aha moments. I was feeling this at the time. This was going through my mind at the time. These emotions are what I felt at the time. And when this happens, there is definitely in human activity, in human behavior, there is very clear safety in knowing I felt this because of this, right? We can give time and space and context to these emotions. And when we give this time and space and causes and effects to emotions and events, there's something about that knowledge, that clarity, that ability to have control and to understand what happened for us to go forward. And that is something EMDR does very quickly and very easily. And it is very clearly something that talk therapy simply doesn't do very well. And that is really that is really the magic of EMDR versus talk therapy. And in fact, because EMDR does this not just with the bilateral stimulation of the right side and left side of the brain, but we can do a lot of calming techniques with the body, with cross shoulder tapping and knee tapping that also correspond to the right side, left side brain movement caused by the finger movement in front of the person. And so after a series of this, what can then come across, what can then evolve, is a sense in which people have a clearer, calmer sense of having control over the event. And then they have control over the emotions of the event. And then when they have that, they can then move forward and say, what did I believe about this event at the time that it happened? And that's really the key. The key is to say, what did I believe about myself at the event? And then when we're sitting in front of a motivated adult person who can have this kind of clarity and a sense of emotional control in a safe space, is to say, maybe the things that I believed about myself simply aren't true. Because at the time I believed I was a coward. I didn't do enough. I didn't tell anybody. I didn't ask for help. That's a critical one. We so often, in coming from dysfunctional families, the last thing people want to do when coming from a dysfunctional family is to ask for help, because normally help makes the situation worse, or the help is unreliable, and so we stop asking for help. And that's really a key element of what happens to people who come from dysfunctional, troubled families when they're in situations of coercion, feeling trapped, feeling assaulted, feeling like there's nobody around. They take that in and they take it as true. And there's so many things that we take as true in belief systems when these assaults happen, that is the precise essence of the post-trauma stress. The post-trauma stress is I take beliefs into the future which stay with me, which is in the case of violent assault, PTSD, death of a loved one, overdose of a loved one near me, it was my fault. I didn't do enough. I didn't ask for help. I'm the one to blame. I deserve to be punished. I deserve to go down for this. I don't deserve love. I don't deserve to be in relationships. And so these are the things that the broken record people play going into adulthood. The same is true in sexual assault, where the sexual assault is something where I deserved it. My body is just to be used by anybody else who comes along after this, where I didn't ask for help, so something must be wrong with me, or did I like it, right? And when we are trapped in those false beliefs, we get into a pattern of, very common with sexual assault, sexual promiscuity, because this is the way that I can show my value, because I must have, created some sort of value, because I have to make this event something important, even though it was not, even though it was one event that might have lasted a couple of minutes, which people take into their future lives for decades. And so EMDR is a way to examine these beliefs and say, is that really true? Do you think is that really what happened? Is there something else you have in mind now that you think was really the case? If you can stand back, be on top of this person, be next to this person? Is there a different way of looking at this now that is more true, more correct, more accurate? And virtually every single time we are not looking at wishful thinking. We are not looking at planting a false set of beliefs with somebody else, right? Somebody else's views, right? All of the words come from the client. All of the thinking, all of the beliefs, all of the descriptions come from the client only. There was no suggestion here. There was only eliciting a different set of answers to a certain set of questions. And this is the magic of EMDR. There's no implantation. There's no suggestion. This is a reflection of seeking out and finding the source of false beliefs, naming the false beliefs, and looking at what else is workable in a new understanding of this person going forward, knowing that this person is capable and an adult and can protect themselves and create safe places for themselves and has places and people and things that are also offer safety. And so this is really what I want to get to in the essence of the connection between PTSD and EMDR. So more later.